Alright, let's talk about something deep today, addiction. But before you start thinking I'm just talking about drugs, slow down. Addiction isn't just about substances, it can be any behavior. And I mean anything: shopping, gaming, social media scrolling at 3 a.m., yeah, even caffeine. Basically, if you're enjoying something, craving it, finding relief in it, but it's wrecking your life and you still can't give it up, that's addiction. Now, sure, we're all familiar with the heavy hitters: cocaine, heroin, alcohol, and, lately, opioids like fentanyl have been wreaking havoc. In 2019 alone, over 70,000 people in the US died from drug overdoses, and 70% of those were opioids. But addiction doesn't stop at drugs. It could be your phone, your job, or even exercise. Anything can be addictive if it follows that pattern: short-term pleasure, long-term pain, and the inability to stop. So here's where it gets real. Addiction isn't just some bad habit or random brain disorder. A lot of the time, it's rooted in something much deeper: childhood trauma. Ever heard of adverse childhood experiences, or ACEs? The ACE study showed us that things like physical or emotional abuse, neglect, a parent struggling with addiction, or even divorce can mess with us long term. In fact, over 61% of people have gone through at least one ACE. But here's the kicker: the more trauma you experience as a kid, the higher your chance of struggling with addiction. If you've got 4 or more ACEs, your risk skyrockets. Think about it. Kids are supposed to feel safe, right? But when you grow up in chaos, your brain changes, and you learn to survive in ways that might hurt you later. Those bad coping mechanisms, whether it's drugs, alcohol, or scrolling endlessly on TikTok, become ways to numb the pain, the anxiety, the depression that comes from unresolved trauma. What is trauma really? Now, let's break down what trauma really is. People often think trauma is the bad stuff that happens: parents fighting, abuse, neglect. But trauma is actually what happens inside you because of those events. It's the way you disconnect from your emotions, the way you stop trusting your gut. Trauma isn't just an event, it's how your body and mind respond. When you're a kid, you have 2 basic survival needs: attachment and authenticity. Attachment is being connected to others, feeling cared for. Authenticity is being connected to yourself, knowing what you feel and acting on it. But here's the problem. When you're in a stressful or traumatic environment, those 2 needs come into conflict. Like, if expressing your emotions makes your parents pull away, guess what? You're gonna bury those feelings to stay attached. You lose your authenticity, and as you grow older, you don't even know who you are anymore. That's how addiction creeps in. It's a way to fill that emptiness. The cost of addiction in ACE is serious. So, what does all this look like in the real world? Chronic health problems, broken families, economic struggles, and, unfortunately, early death. The CDC reported that substance misuse cost Americans more than $500 billion a year. That's billion with a B. And for people with high ACEs scores, 6 or more, the likelihood of using hard drugs like heroin shoots up by over 1,000%. Let that sink in for a moment. We're not just talking about adults here, either. Nearly 12% of high school seniors reported daily nicotine use in 2019, and a quarter of adolescents with major depression are also using substances. The cycle starts young. Treatment and breaking the cycle optimistic. But here's the good news. Addiction isn't a death sentence, and trauma doesn't have to define your life. Recovery is about one thing: reconnection. It's about reconnecting with your body, your emotions, and the people who matter. In fact, the word recovery literally means to find something again. And what do people find in recovery? Themselves. According to the American Society of Addiction Medicine, addiction is a biological, psychological, social, and spiritual issue. So when we talk about treatment, we need to look at the whole person. Trauma-informed care is critical here. This means addressing not just the addiction, but the trauma that led to it. For counselors, doctors, and mental health professionals, it's about treating the person, not just the addiction. And guess what? It's working. Programs like trauma-focused cognitive behavioral therapy, TFCBT, and medication-assisted treatment for opioids and alcohol are changing lives. And it's not just about the individual. It's about breaking those intergenerational cycles of trauma. When you heal, your family heals, and future generations benefit. A call to action. We need to start early. Kids are being exposed to trauma at alarming rates, and we're seeing the effects now more than ever. With the pandemic, domestic violence incidents have gone up 30%, leaving so many kids vulnerable to ACEs. But it's not hopeless. Prevention programs, early intervention, and creating safe, supportive environments can change the future. If you or someone you know is struggling with addiction or trauma, there are resources out there. The Substance Abuse and Mental Health Services Administration, SAMHSA, has a national helpline at 800-662-HELP. The CDC also offers training on how to prevent ACEs and build resilience in communities. At the end of the day, addiction is about more than the substances or behaviors. It's about trauma, it's about survival, and it's about the human need to feel connected, whether that's to ourselves or to others. But healing is possible, and recovery is real. It's time to break the cycle, one person, one family, one community at a time. Here's to recovery, reconnection, and finding ourselves again.